Hey, it's Dr. Amanda with Straight Smile Solutions. We're now on step 4 of how to submit a ClearCorrect case. This is the preferences page or whatever they call it. I don't know what they call it. This page is like important. It's the most important, but it's the most confusing. They could have done this way better. So I'll try my best to explain it to you. And remember that we do help doctors submit their ClearCorrect cases. If that's the case, if that's the lab you want to use, we can help you with this. We have really low fees. It's really important to have someone guide you through your first 5, 10, 20 cases to make sure that you're doing it right. Otherwise, you're not going to get good treatment plans. So, basically, this is like a little bit confusing here. So, they pre select it here. So, they pre selected improve here or maintain here or only if needed here, but you can change these improve, maintain, or only if needed, right? So, or maybe improve, maintain, idealize, I think are the options here. And this is going to be only if needed, yes or no are the options. So, I mean, it really is up to you. I mean, of course, it's easier for them if you click improve, right? Because then they're going to basically give you an improved treatment plan, but not a perfect treatment plan. Now, some patients are only looking for improved, but my suggestion is to start with perfect, show your patient perfect. And then if they're not looking for something that long or that um, too much of a long duration or that intense or anything like that, you can always step back certain portions of it to improve. But just to blanket, have improve and maintain, you're going to have a bad treatment plan. And to me, um, that's like not even putting your best foot forward. I don't really understand that. So obviously, I want my midlines almost always on. I'm going to hit idealize on those. Overjet, overbite for the most part, I'm going to hit idealize, arch form, idealize, canine relationship, idealize, molar, maybe not. Maybe I'll hit improve. It's not always that important. Posterior crossbite, you need to think about this one because if you tell them to fix it, they're going to fix it, but it's not always possible. And sometimes you can majorly damage the bite, indefinitely, purposely, like forever by clicking this. You need to know if the crossbite actually can be fixed. Just because they're technicians who are just like random people that aren't even doctors in Pakistan say it can be done doesn't mean it can be done. You need to know. And if you don't know if this is the right thing to do, you shouldn't be doing this. Like, you need to get more training. You should know the answer to that. So this is, I guess, the most serious part of this submission is this one right here. I'm glad that they have maintain as the default because I pretty much want you to leave it like that unless you know it can be done. But okay, so that's my soapbox about crossbites. Let's talk about these guys. I'm okay with the only if needed here for most of this. I mean, if it needs to be done, we do it, of course. There's sometimes I look at a case and I know I want IPR. Okay, so for example, if it's a perio case or a case that's already very flared, tipped out, I'm not gonna want to do it more. So I'm gonna hit IPR yes on that. Sometimes I want to say no on engagers. I mean, that's pretty much a one-off, but sometimes patients traveling, I'm not going to be checking in. Patient really doesn't want them. Sometimes it's not possible to make that case perfect, so I would never overpromise on those cases, but in that case, you're going to say no on engagers, but don't expect something really nice if you do that. Again, procline and expand. This is the opposite of my IPR. If it's a younger patient, under age 18, healthy patient, lots of bone, all tissue health, great tissues, no perio, no bone loss. Yeah, let's do it. Let's do procline and expand. Obviously, you're going to want to look at the soft tissue. You're going to want to look at the profile, right? If it's a crowding case or even if it's a spacing case, and think, okay, if we're leaning things out and forward, is that going to be healthy for the patient? Remember, again, their technicians are just random guys in Pakistan. So they're not people that really know ortho. They're not orthodontists. Or at the best, they might be a dentist in Pakistan. So they're not, it's not the caliber of a US trained dentist or orthodontist. So you cannot, just because they say something can be done, doesn't mean it can be done. You need to know if it can be done. You're basically just having them play this tedious video game for you. You could do this yourself, except for it's tedious. And you can, if you want to do ULab or something, that one's not that bad. But these are people that play the video game very fast. You tell them in your words what you want, and they will extrapolate it into the treatment plan. Don't let them decide for you. I can't tell you that enough. Distalization. Don't do that unless you know how to do it. That's a hard movement. Obviously, you're going to probably need elastics for that. They don't incorporate that at the moment. Moving teeth without an elastics is not going to work that well. So, and remember, if you're distalizing, you can't run into other teeth. You're going to run into third molars, run into second molars. You need to think and know what the side effects are going to be if you're going to do that. Okay. Um, this notation is just how you want your charting. Do you want it universal? Do you want it Palmer? You know, there's all the different options. Um, so you need to click international, whatever one is your type of charting. Obviously, I use Palmer. You probably use universal. Any teeth that you don't want to move are going to be teeth that are bridges, implants, or primary teeth. You go ahead, you got to use your pano, click them. If you do not click them, they might move them. If they might move them and they shouldn't be moved, they might get damaged or fall out. So take the time to mark this. Avoid engagers. These are teeth that I would click out would be porcelain crowns, gold crowns, veneers, and buccal fills. Again, you need to look at your charting. You need to look at your open dental, your dentrix, and mark these teeth. Yes, you can bond to porcelain crowns, you can bond to veneers, but you might damage them, okay? And you might have to rough them up. You're gonna definitely have to buy a Porce Etch kit. See my videos on Porce Etch. It's a whole different ball of worms. Can of worms. So, you know, these, you need to let them know where to avoid it. Of course, if you're avoiding too many, things may not move as fast or accurately. Teeth to be extracted. Wisdom teeth. Remember, if you're doing a scan impression, you need to capture the distal of the most terminal molar. That means if wisdom teeth are erected, you have to capture them fully. Or at least, just say fully. And sometimes you can maybe get away with 2/3 to 1/2, but it depends on the movement. So I'd rather just say fully. So if you can't do that, then you need to think about yanking those before you deliver it. In that case, you're going to go ahead and block them out. ClearCorrect is not indicated for 4-by extraction. Hopefully you're not doing 4-by extractions. Only other one that you probably would be doing besides wisdom teeth would be a lower incisor extraction, which may happen occasionally in a severe clouding or class 3 case. Lastly, leave these spaces open. This is better. They did this a lot better than they did on the old portal. You're going to click on one of these little thingies, okay, which is like an interproximal space. Like, let's say you wanted to do veneers on 7 through 10 after treatment. You are going to click on the spaces you want to leave open, so that they leave a little extra space. And I don't know if they let you quantify it. I don't think that they do. You just click it. But at least they know that they're supposed to leave extra space for an implant, you know, a veneer, some type of buildup, something like that. So, all right. So again, this is the most important page of your ClearCorrect instructions. So proceed carefully and please get help if you don't know what you're doing. All right. Thank you.